Hello, my name is Dr. Robin Crouch. I am a wellness chiropractor as well as a brain core neurofeedback specialist in Port Washington, New York, and I'm really excited you're taking the time to watch this presentation. I'm hoping to offer you some great information on how brain core neurofeedback may be able to help the symptoms of anxiety, whether it be for an adult or for a child. So I'm going to ask you that if you do have questions to hold on to them. If you must ask a question, go ahead, but I'm going to ask that you hold on to your questions and email them to me so that way we can get through the presentation pretty quickly, okay? So what is anxiety? Well, anxiety is a normal biological response, right? So if something is terrifying or fearful or something that poses a threat to our personal safety, our body needs to respond in a particular way to be able to run really fast away from that situation. So anxiety is a normal function, but sometimes it can get a little too overwhelming for us and anxiety becomes a problem. So normal anxiety is if that rhinoceros is running after you for your heart to speed up and you start sweating so you can really run away from that rhinoceros. But if you see a toy rhinoceros, you shouldn't have those same feelings based on that being a threat because you know that it's just a stuffed animal. But sometimes anxiety that's too strong or happens a lot becomes overwhelming. It can interfere with someone's ability to get things done. In severe cases, it can start taking over the good part of your life. So common types of anxiety disorders are generalized anxiety, obsessive compulsive disorder, phobias, social anxiety, panic attacks, and post-traumatic stress disorder. And some of the symptoms could be things like feelings of panic, fear, and uneasiness, which if a rhinoceros is chasing you, you should feel that. Problems sleeping, cold or sweaty hands or feet, shortness of breath, heart palpitations. So again, if you're running away from something that's terrifying, your heart needs to pump the blood faster to get you be able to move. An inability to be still and calm, dry mouth, numbness or tingling in the hands, nausea, muscle tension, or dizziness. Oftentimes, anxiety disorders can develop into depression. So a continued feeling of anxiety and panic can cause depression, and then that creates more anxiety and more panic and more depression, and the cycle just continues. And the standard medical approach is treating most anxiety disorders a combination of therapy, so cognitive behavioral therapy, antidepressants, or other types of medications. And there's a black box warning with most of these medications, so it emphasizes that patients of all ages taking these medications should be closely monitored. So people can have agitation, sleeplessness, suicidal thoughts, and the caregivers or parents should also be told of the need for close monitoring to report any changes to the physician. So all this information can be found on the FDA website. So also on a note of that, a lot of times the anxiety medication can cause side effects, and then oftentimes other medications are prescribed to counteract those side effects. So then the person winds up on a whole host of medication. And we're really not sure what that's really going to do to the brain. So yes, obviously when the person's taking the medication, it's making a big difference, but it's really not changing how the brain is going to work. If you take away the medication, you're still left with the same problem, right? So they don't really know what causes anxiety disorder. So several things can play a role. So genetics, brain chemistry, an overactive fight or flight response. So you see that rhinoceros and your brain tells you to run. That happens over and over again. The window gets closer. So the slightest little thing, that stuffed rhinoceros, could cause you to become anxious. Somebody who has very stressful life circumstances could cause anxiety, and that makes sense, right? It could also be a learned behavior. So a healthy regulated brain is able to shift between arousal states as the demand arises. So we have slower processing for things like relaxation, getting ready for bed, and this is associated with particular brainwave patterns called delta and theta. And then we have idle processing, and this allows for our brain to do routine activities like tying our shoe, brushing our hair. Meditation also falls into this category, and this is associated with alpha brainwave patterns. And then we have faster processing for things like learning new material, giving a presentation. This is faster processing, and this is associated with beta brainwaves. So some of the new research out there is showing us that anxiety can be correlated with a dysregulated brainwave pattern. So whether somebody is stuck in a faster processing, slower processing, or an idle processing. So there are three types of those dysregulations. So there's the delta theta, which is that slower processing, alpha, which is idle, and beta, which is fast processing. So somebody who is stuck in that slower processing, which we also call the under-aroused brain, could have symptoms such as cognitive impairment, ADHD, be disorganized, have excessive speech, learning disorders, easily distracted, and a whole host of other symptoms that could present with that particular type of brainwave dysregulation. And then there's alpha, or we call it the inhibited brain, and this tends to operate in an idle processing speed. And things like depression, self-deprecation, agitation, withdrawal behavior, irritability, passive aggressiveness, those things can be considered in the idle processing inhibited brain category. And then there's the beta dysregulation, the over-aroused brain, and this is too much fast processing. And this is usually what happens when somebody has anxiety. Things are just going too fast in their brain. So it could also be things like chronic pain, restlessness, poor emotional self-awareness, obsessive thinking, insomnia. So if your brain's going too fast all the time, obviously it's going to be hard to sleep. OCD, migraines, tension, headaches. So those are all kinds of things that if somebody has an over-aroused brain, they may experience those type of symptoms. So obviously we want to do whatever it takes to help our brain or our family member's brain work better. So there are a whole host of different things that you can do to help that happen. So I already explained how with anxiety, it's often a matter of too much fast processing. Things are going too fast in the brain. So what are some things that we can do to turn down that switch in the brain? So one thing that's really important for the brain of anybody is proper nutrition. Nutrition and food are fuel for the brain. So it's really imperative that you eat whole, clean food. So that means sticking to the perimeter around the outside of the supermarket. Really trying to get off the processed food, things that come in boxes. If you can't recognize what some of those things are, you really shouldn't be eating it. And all those chemicals that are in those processed food really affect how our brain is going to work. So eating whole food, clean meats, all that kind of stuff is really important for the brain, and particularly somebody who has anxiety. So some things that you really want to avoid are sugar, because sugar speeds that process up. Caffeine is another one of those things. I know I'm a caffeine addict, but if you do notice when you drink something with caffeine, it speeds everything up. So if you're already prone to anxiety, caffeine is probably not a good idea. Like I said, processed foods, really not good. All those chemicals really affect the processing of our brain. That saying you are what you eat is really true. So you really want to stick to clean, whole foods. If you need more information about that, we'd be happy to guide you or send you to somebody who can really help you through that process. Alcohol is another one. Alcohol is a depressant for the brain. So sometimes people use it as a, to self-medicate, but it really affects how your brain is processing. So another thing that I think is really important is to really watch the chemicals that you're using, whether it be on your skin, in your hair, in your households, all those cleaning products out there that you see in the store when you walk down the aisle and it has that super potent smell, all that stuff are toxic chemicals. So figuring out ways you can use natural cleaners, natural hair care products. I happen to make a lot of my own stuff. I use essential oils for my cleaning. Young Living makes some great products for cleaning. It may be one of the best natural cleaners that I've ever used, and I've tried all of them. So if you want information about that, you can just give me an email. So with the lotions, the potions, our skin is the biggest organ in our body, and it absorbs all those chemicals, and then that goes into our bloodstream. Another really important thing for somebody with anxiety, and for everybody in general, is exercise. So when we exercise, it stimulates a part of our brain in the back, which is called the cerebellum. And the cerebellum then drives to the front of the brain, which is the brain that perceives a threat first. So a threat comes into our view, the front part of the brain is going to decide whether it's something to run away from or if it's something that we don't have to worry about. So the more we can get that front part of our brain working better, the better off we are. So when we exercise, not only is it great for all the other areas of our body, but it's really good for our brain as well. So somebody with anxiety, it's really important that they're exercising. So a newer thing that I've discovered, which has been around for centuries, is essential oils. So there are a lot of essential oils that can really affect how your brain is working, that can help with anxiety, depression, fear, anger, and all that part of the brain that deals with that is the limbic system. So that's all the memories and all of that. So what happens when we inhale essential oils, it goes straight to the brain. Our sense of smell is the only sense that goes directly to the brain. So you inhale any kind of oils that are particularly help to reduce stress and tension, and it can help combat some of the symptoms of anxiety. So there's a bunch of different oils that you can use to help when anxiety strikes. These are just a few ideas. Look, if I move myself out of the way here, yeah. So here are some oils that are known to help with anxiety. And again, if you want some more information on that, I do classes just on essential oils also. So if that's something that interests you, something you might want to try, give me an email and I can get you set up with one of those presentations as well. So what we do in our office, the neurofeedback approach for anxiety. So research over the last 40 years has demonstrated that an inappropriate, I'm just going to slide myself down here, sorry guys. So over the past 40 years, research has shown that inappropriate brainwave activity is at the core of most neurological conditions, whether it be anxiety, depression, insomnia, ADD, all neurological stuff, right? So all inappropriate brainwave activity is going to fall into one of those processing speed categories, and it's all related to brainwave dysregulation. So neurofeedback is a sophisticated form of biofeedback, which is something that most people have heard about. And neurofeedback actually trains the brain to normalize those brainwave patterns. So somebody stuck in that faster processing, we can train the brain to slow down and become more adaptable to situations as needed. The cool thing is about neurofeedback is those changes, they've shown to last up to over 30 years. So like I said, neurofeedback is based upon the principle that normal brainwave pattern activity and that brainwave regulates itself based upon this pattern. So research demonstrates that this normal pattern may become disrupted in resulting in a dysregulated brain and causing neurological symptoms. So somebody who has normal patterns starts having too much fast processing, it could create neurological symptoms such as anxiety. So what we do is we take a brain map and we use a QEEG, which is a quantitative electroencephalogram, or QEEG, that reads the brain patterns from a cap that is placed on the head, and that information gets uploaded to a database. So obviously nothing's going into the brain, we're just reading the brainwave patterns coming off the brain. The way our brain communicates is through neurons, and these neurons fire, and they create a lot of electrical activity. And we can read that electrical activity using an EEG. So that information gets uploaded to a database of over 100,000 normal scans. Normal meaning people that reported no symptoms, because I don't think any of us are normal anymore. And then it comes back and gives us a map. And the map shows us what area of the brain may be having some dysregulation and in what category. So in this case, this person, there's a 60% chance that they have an over-arousal dysregulation. So they might, most likely, this might be somebody who comes in complaining of anxiety. And then it shows in what area of the brain they are having an issue, whether things are going too fast or things are going too slow, and in what part of the brain. This column is what the patient or the parent fills out a questionnaire, and then this column shows us what what's the probability that that person might be experiencing that particular symptom based on their map. So generally, if there's a match, then they're most likely experiencing that symptom at a high level. So in addition to showing us the overall global dysregulation, it's going to break it down into each section. It's going to show us what that person's brain is doing as far as dysregulation, so the function of each site. So here, up here, this is often, this is the frontal lobe, and this is what I mentioned before, what your brain perceives as the first thing that comes at it, whether it's something to be afraid of or not. So the brain map does two things for us. It identifies the global dysregulation and also the specific focal dysregulation brainwave patterns. And then it allows us to provide statistically the best protocols for that particular person in order to help correct those dysregulated patterns. So we're not trying to diagnose or treat any particular condition. So what we're really trying to do is get the brain to work better. So whether somebody's experiencing anxiety or whether they're experiencing symptoms of ADHD, what we're trying to do is get the brain to work better. So the goal is to transform an unhealthy, dysregulated brainwave pattern into a normal, healthy, organized pattern. So it doesn't matter what the symptom is, our main goal is to get the brain to work better. So what then happens once we get that map information and we get the protocol, what we do is we use sensors, and again, they're not putting anything in the brain, they're basically acting as antennas. And the individuals are hooked up to the computer using those sensors. So you can see here this person has the sensors attached to their head and to their ear, and then they're sitting there watching a screen, and we can see the brainwave patterns in real time on the doctor's monitor. So this would be somebody's brainwave patterns in real time. And then the software automatically detects when the brainwaves are properly ordered, and it feeds that information back to the patient. So the feedback can appear in the form of a game or a movie or sound or music, which signals the patient that the brainwaves are being more ordered. So here's a roller coaster, here's somebody watching a movie. So what happens is the person is sitting there relaxing, watching a movie, for example. The moment their brain moves into more organized patterns, say for example somebody has too much fast processing and we want it to slow down. So the moment their brain slows down, whatever's on the screen is going to play brightly. And the moment their brain starts to speed up again, whatever's on the screen is going to get dark. So the brain learns in order to get the movie to play brightly, it's got to slow down its pattern. And as time goes on, it learns to do that more and more. And through the process of neuroplasticity, our brains have the ability to learn and change. So it creates new connections, healthier connections, and whatever that neurological symptom is can tend to dissipate. So when you have information on what your brainwaves are doing, your brain can use that information to change how it works. So like I said before, neurofeedback is based on over 40 years of clinical research. There's some great books out there. Two of my favorites are Symphony in the Brain. It's written by a journalist. And then there's Healing Young Minds. It's more about children, but it's a basic read, so it gives you the basic concept, and it has many of the neurological symptoms in there: anxiety, ADHD, learning disorders. Plus, there's tons of peer-reviewed research out there. If you go on to braincoretherapy.com, you can find some of those research articles if that entices you to learn more in that perspective. And always, you can call me at 516-944-4469 and ask me any questions you want, or you can give me an email at drrobincrouch@gmail.com. I'd be happy to answer any of your questions. And again, you could also go onto braincoretherapy.com website. If you go onto YouTube, you can find some other videos and patient testimonials from all across the country. We are offering you, and this is for the Port Washington office only, if you tell us that you watched our presentation, we will give you $75 off your evaluation, and that includes more than one family member if you want to get a QEEG for more than one person in your family. I hope this gave you some good information on how neurofeedback may be able to help symptoms of anxiety, whether it be for you or a family member. And like I said, I will answer any questions. Just give me a call, give me an email. We are here to help. So again, thank you for watching this presentation. I hope to talk to you soon if you have any questions. Have a great day.